All right, and of course, you can get the day's latest headlines for everything happening on Guam on KUM.com. And the sun shines brightly in the Marianas, and Tomas Manglona is a perfect example of that because he is dutifully positioned. Tomas, is that Beach Road you're on?
Yes, I'm here at the Beach Road on Saipan with some of the latest headlines here in the CNMI. I do want to start off with the unfortunate news last night of yet another COVID-19 related death, this bringing the CNMI's total death toll to 25 since the pandemic began. The Commonwealth Healthcare Corporation also reporting 11 people are hospitalized for COVID-19 on Saipan, 3 unvaccinated, 8 are vaccinated, and unfortunately one of those patients are on a ventilator. Also last night, 159 new cases of COVID-19 on Saipan. 8 were identified on Tinian, and 1 was identified on Rhoda. And Chris, Jason, Vic, and Joser, as you might have seen last night on primetime, we're currently experiencing some testing slowdown here in the CNMI due to some erroneous results garnered by the Solgent PCR testing platform from South Korea. It's not clear how many tests are left or the capacity here in the CNMI for testing, but we're hoping to get more information on that throughout today from the Commonwealth Healthcare Corporation. I just did want to also explain why that's become an issue. First off, with the Solgent South Korea test kits, you can store specimens for up to 72 hours. So that allows for more testing across a period of at least 2 or 3 days. On the Abbott platform, which is currently the one that they're using now, specimens are only viable for about 24 hours, which is why it's becoming an increasing issue. You can get a little technical there, but that's part of the reason why testing has slowed down. And so today they said they're doing their final checks on the Solgent test kits from South Korea to see if they can bring that back on board. We also learned yesterday from that panel at the legislature with some of the leaders leading the COVID-19 response here in the CNMI, about a fourth of employees at the Department of Corrections have been infected with COVID-19. Currently, about 30 inmates have contracted the virus currently, and they've obviously also had to designate a quarantine site, as we've reported. They tell us that Wally Villagomez, who's the commissioner at the Department of Corrections here on Saipan, tells us that they're constantly disinfecting, doing COVID testing, and that they also need to fix their ventilation. The Commonwealth Healthcare Corporation CEO also sharing some new information we wanted to bring to you here first on the link this morning. She tells us that the CNMI hospital continues to face mounting pressure as the COVID unit expands. It's a 76-bed hospital, the only hospital in the CNMI. And with regards to staff infections, Esther Munya tells us that about 150 staff at the CNMI hospital have been infected with COVID-19 throughout the course of this pandemic. But that's out of 900 staff. So they have about 900 staff there at the Commonwealth Healthcare Corporation. Some of those details emerging at yesterday's panel with some of the government and public health officials in the CNMI. And we also got a chance right before then to chat with Secretary of Finance David Attilig. We got to interview him about premium pay. There's about $30 million allocated for premium pay here in the CNMI. So we interviewed him in person, wanted to share this interview with him, and we'll have more tonight on primetime. But take a listen when we asked him whether or not private sector workers can expect premium pay. Here's that clip. Okay, so I just wanted to ask you, for the public who's asking, what is the future of premium pay for private sector workers? What is your answer to them?
Well, at the moment, we're binded by the spending plan that we have. And we have more information today. We'll review and look at if we can make funding available. We would love to do so. At the moment, our current spending plan was allocated for government frontliners and government workers, as well as the private healthcare facilities that helped with the COVID mitigation and for that, the dealing with our COVID situation.
Do you know how many private healthcare facilities those?
We are compiling the information. We received requests from several health clinics and also the pharmacies, and so we're reviewing their requests for premium pay, which was part of the plan, our spending plan.
And you said about 4.5 for them.
4.5 million was allocated for premium pay for the private healthcare facilities.
And I'm sure you've seen the SLFR, I think is what it's called, the state and local recovery funds, right? Which is what premium pay is paid under. It does say that the chief executive or the designee has the latitude to basically designate premium pay for non-public sector workers. So if it's up to you, I guess some people might be looking at that ruling which came out in January from the U.S. Treasury and ask why not just open it up to everyone who has that request. Can you address people who say why not just widen the net?
Although it sounds a lot, and it is a lot, we did receive $481 million for ARPA. And a part of that, and as we put together the spending plan, which approved and submitted to U.S. Treasury, we know more today than we did at that time. And they also know that, keep in mind, that it isn't really enough as compared to a lot of the states and other territories. You know, the allocation that Puerto Rico got, U.S. Virgin Islands. Yes, understandably, their population is more, but not necessarily U.S. Virgin Islands. They have a population that's smaller than Guam, but a lot of programs that is going there, which helps them, which is fine. We just know that if we had the funding that like a lot of states have that are able to provide, we cannot match or mimic every state's programs that they have. So we try to research what is the best, what are they doing, what's the best that we can do. Is there a way for us to provide? Maybe not a lot. Maybe we can help a little. We're still reviewing it. I have my ARPA team looking into it. And
how much more are you willing, would you say, is the cap for this premium pay? Because right now it's 30 million is the self-imposed.
That's
threshold.
correct.
What do you think practically? I know this is,
If I'm, we're speaking scenarios right now, but let's just say we can identify $1 million. How can we spread that $1 million, Sister? I mean, I'm just hypothetically using a number.
But you're not expecting any substantial increase from the 30 million?
No, I'm not. We had a lot of expenditures with this spike in this of COVID cases. We have a lot of expenditures that we didn't anticipate that we were going to have due to the spike. Because keep in mind, for many, many months, the Commonwealth has been pretty much free of this community spread. But once we had that, it kicked in, Omicron kicked in, it really put a lot of hamper on our resources. But fortunately, we were able to use ARPA because that's what it's there for. And so now that monies that we thought we had for other programs, maybe it's not there as much, but we're looking at and we're trying to look and review. We have a budget submission April 1st to the legislature, and as part of that review, we're also looking at our current levels of spending with ARPA and how much are we going to share or allocate in the next budget so that we can get the blessing of the legislature for that plan.
And the April 1st is, that's a full report from start to present?
Yes, April 1st will be our submission for FY 2023 budget, but in that report, the budget submission, we need to show a report to give that information justifying our FY 2023 budget.
Okay, all right, thank you, sir. All right, so that was Secretary of Finance David Atchalik that we got a chance to speak to him one-on-one in person outside of the legislative hearing that he was testifying at. We also wanted to just bring you back to the very beginning of when the NMI premium pay was first announced. So just a few months ago, the NMI government told us that frontliners were going to receive premium pay here in the NMI, $1,000 to $5,000. The Governor Raptor is saying that employees who worked at least 40 hours since the pandemic began as a part of the direct COVID-19 response will receive $5,000 in premium pay. Public service employees who worked to provide essential services will receive $1,000 in premium pay. This is the governor's quote then when he made the announcement. The ongoing COVID-19 pandemic, he says, has brought upon unprecedented challenges for our Commonwealth. and has required a proactive response to safeguard our community. We owe great thanks to our CNMI government frontliners, first responders, and employees. Their hard work and sacrifices have made to ensure the safety and well-being of our community during such challenging times is something to be grateful for. Yet they deserve more, and I wish that we were able to give them more. The Secretary of Finance then, when this news first came out, told us, of course, that the premiums are funded by the American Rescue Act spending plan. And according to the governor's communications team, Brianna Hunter, then about 458 frontliners received the $5,000 premium pay, and about 2,000 or 1,955 to be exact received the $1,000 premium pay. So Chris, Jason, Vic, Joseph, we're going to break this down for you on tonight's newscast. There's a lot of other agencies requesting this. The private sector wanting their slice of the pie. Yesterday, which we'll bring you tonight, lawmakers press Secretary of Finance in the CNMI, David Atchalik, asking why not expand it to basically, all the private sectors who, as we all know, were on the front line, many of them listening right now. Him saying that there were other programs that existed that private sector could avail of that the government necessarily didn't avail of. Obviously, those other programs were not premium pay. Were not the same in nature in terms of being an addition to what you were receiving. Those other programs made, one lawmaker pointed out, those other programs made up for what was lost, didn't add to the services that were provided. So we're going to have all of that tonight. We also just published a story, was able to obtain documents in terms of the ongoing impeachment process for the CNMI Governor, Ralph Torres. Tomorrow, Chris, they're expected to release the impeachment rules. That's what we're hearing. Which would set in motion the scheduling for the Senate impeachment trial, and also set the parameters in terms of who's going to preside over the trial, how many impeachment managers, basically the prosecutors from the lower house, are able to be had. And again, a lot of people also wondering who will be the governor's lead counsel on that effort, if it's going to be his regular counsel in the government's office, Gil Burnbrick, or another private attorney, or possibly the DC-based lawyer Ross Garber, who we've reported on. But I just wanted to put into perspective this full story you can read on KUAM.com. The CNMI government, which is entitled to legal representation in these proceedings, so far, as of the 14th of this month, we're able to confirm they've spent $121,000 in legal fees for at least 12 of their witnesses, in addition to Governor Ralph Torres' representations, and across about six attorneys and law firms. And so this is the first that we're hearing of that, and we placed that full report on KUM.com. So no shortage of things to track here, and we'll continue to bring you the latest as it does come in. The COVID-19 response, premium pay, federal funds, the governor's impeachment trial. We'll have it all for you on KUM.
Yeah, Tomas, that premium pay for the private sector workers, that's a really interesting one. And I want to go back to what the finance secretary, right, is who you interviewed?
Yes, David Atchalik, yes.
Right. What he said, what the private sector employees were involved in other programs. But I think that with the government workers, and even here on Guam, the best program they were involved with was the one where they got to keep their jobs. That was probably the best.
Yeah. And one lawmaker, again, pointing out that a lot of the assistance that did come in, granted it is federal assistance, but those made up for lost time, for lost money. And in a sense, this premium pay is awarding that extra time and that recognition. Of course, right. When it comes to whether it's PINs, Chris, or premium pay, a lot of people are asking, what about us? And that's the question we'll continue to ask. It seems like the secretary was saying that they're only maybe willing to add an additional $1 million for non-government workers. And as we were talking about, and as we reported, that final ruling from the U.S. Treasury saying that the chief executive basically has, the latitude, has complete control over how this premium pay works out. Of course, David Atchalik responding to that saying, ARPA isn't an eternal river. It's going to end somewhere, and that date is 2023, I believe. And so 481 million, 30 million of that is used for premium pay. That's what they're sticking to. Well,
we've got about the same amount left sitting in the bank, Tomas. So Good talk, and I wonder what kind of conversation we're going to have here locally with the premium pay. I'm not sure that we've gotten much of a comment from our governor. I think we asked her about it last year. She said that, well, she didn't say much of anything, but it's really been Congressman St. Nicholas who's been pushing for the premium pay. I know he's mentioned it a few times in his press conferences and on his Facebook page as well.
Yeah, Chris, you know what people say when they receive federal funds, right? They say thank you for the federal funds.
That's what they say. Oh, I got you. Yeah. Right on. Tomas, thank you for your time this morning. And one thing I love about Saipan, I think I said this last year, is you're on Beach Road. They keep it simple. So the road by the beach is called Beach Road. The road in the middle of Saipan is called Middle Road. And then
the Capitol, which is on a hill, is called Capitol Hill.
On Capitol Hill, right. They make it easy. A beautiful day there in Saipan, Tomas.
Yes, bringing you these live images right here on Beach Road.
That's right, live from Beach Road. Which way's the Apigigi is all we want to know.
All roads lead to Apigigi here.
That's it. Tomas, thank you, my friend.
All right, thanks, guys. Have a good day.
There you go. All roads lead to Apigigi and hopefully a little ice keki too. Hey, we're brought to you by Pacific Points, Combo Enterprises, ITD, and Jack in the Box. We're going to take a quick break, and we're back to close out the show next, right here on The Link. Good morning.
It's deep diving into what's making news, listening to your feedback, and getting you the answers you deserve. Plus, remembering to laugh a little, too. Join me, Chris Barnett, on The Link, live streaming video on the KUAM News Facebook